Hello and welcome to a special segment about emotional well-being during COVID-19. We are lucky to have in our community a select group of expert therapists that work with families, couples, teenagers, children, and they are keenly aware of the stress and anxiety that many in our community are experiencing as we are at home during this crisis. Joining me today are Lisa Dominici, Executive Director of the Rye Youth Council, Kim O'Connor, and Augustina Rueda, both licensed therapists and in private practice and with many more titles and accomplishments than we can share right now. So let's dive in. Thank you so much for joining me in raising awareness and reaching out to our community with a helping hand. I really appreciate it. So let's start with Kim. Kim, what are you seeing the most need for at this time?
I'm seeing families really have to define what a new normal is for them. We're all going through this together, and there's catchphrases, right, that I'm hearing, creating a new normal. I'm hearing families move from, having more lofty goals of thriving and, initially we were talking about learning a new language, taking up violin, to simply kind of hunkering down and getting through this in more of a surviving way than a thriving way. So lowering expectations for self. And then also coming to terms with the fact that this is, for some of us traumatic, for some of us highly stressful, and having some compassion, self-compassion in the family, having empathy, getting in touch with the fact that there's a lot of sadness around this. There's grief, there's loss.
Right, I was going to say there's anxiety and then there's grief for all the things that we're not getting to do. And how can people explore their emotions, Augustina?
Right, that's such a good question and it's so important. I think really firstly, it's naming it and kind of normalizing it in the family. This is a normal feeling, to feel anxious, to feel fear of the unknown. And I think a lot of it has to do with the family just, that whole idea of the hierarchy of pain. Like, let's just realize that your pain is your pain and your neighbor may be suffering more or less, but really to kind of stay inside of what's yours and let it in and understand that fear and anxiety is nature's protector, right? It's what our body is supposed to do. It's supposed to raise awareness that there's something out there that's scary. And it's kind of like, thank you, I'm okay for now. Like naming that, anxiety and fear and saying like, right now I'm okay. Thank you for trying to protect me. And I think just as a family, being there in whatever it is that each of us is holding and kind of, your pain is your pain. Yeah.
Lisa, what are some of the options that you are making available to the community so that they can reach out for help?
So the Rye Youth Council, our mission is to support the emotional health and mental well-being of youth in our community. And we know that we can't do that without making sure families and parents are supported and healthy as well. So we are creating a parent support helpline that will be accessible Monday through Friday from 10 to 4. And parents will be able to reach out and contact us via email or a phone number, dedicated phone number. And we will guide those parents to local mental health clinicians who will we'll basically refer them to mental health clinicians who will be able to help them and support them.
That's wonderful. Thank you so much for setting that up. And I understand that some people are just making themselves available for these.
Absolutely. It's a very, very generous community we have. And we're lucky to be rich in a number of clinical mental health professionals, and they are making themselves available, and we're extremely grateful for that.
I have read about mindfulness, meaningful engagement, mastery, and movement. But I think sometimes the most elusive of those M's is motivation. Kim, can you give us some tips?
Yeah, it's true. And I believe that, in whatever week we're in now, and I've even lost track, 5th week, 6th week, we all are kind of hitting this wall of motivation and how to keep going through this, not quite knowing when the end date is. And, you know, so for part of it, one of the things that I'm suggesting to families is really sticking with a routine. You know, it's not about, it's really about looking, you know, day by day, having a day by day mentality and having a loosely structured schedule with the small accomplishments, you know, of what needs to happen every day. And if the laundry doesn't get folded for 2 days because there's no motivation there for that, that's okay. It will eventually get folded.
Right. And just to piggyback on that, you started with that earlier, with that sort of self-compassion. Like, there's a lot on social media right now, sort of with these lofty goals of how we're going to have the best bodies and we're going to write the book and do the spring cleaning. It's like, lower your expectations and realize this is hard. So do what you can. The routine is key. Getting up and doing what you can, and not the shoulds, but the how do I use this to sort of deepen my wisdom about what I need in terms of self-care to kind of like nourish that motivation component.
And Caroline, I just want to add one thing also to the mindfulness part. I just want also the community to know that Mondays and Wednesdays from 4 to 4:30, we have an open mindfulness meditation session that's Zoom based, and it's open to anyone in the community. And that information is on our website. And so we urge people to join us for a half hour and kind of learn some of the skills and strategies with their children, even sitting together doing this, that can kind of provide them with some coping skills for this time.
That's wonderful. Now, Augustina, we have some young adults who had started their lives being independent and having their own world, and all of a sudden they're home and back at their parents. And how, have you seen those dynamics? How do they play out? How can we support them and help them? And, we don't know what's going to happen in the fall. We don't know what's going to happen in 6 months.
So these young adults who are sort of on their way to independence, right? It's called individuation. They're kind of out there practicing becoming independent. And their primary source of support is their academics and social structure and their new environment. And they've been evacuated from that. So we can expect a little bit of regression, right? We can expect a little bit of, that grief of loss of independence, loss of social structure. I think there's some teachable moments there about the importance of relationships and friendships. I think having them kind of make some plans to look toward the other side of this, maybe celebrating spring in a different way in the fall, and just kind of helping them reel in when they start to future, when they start to think about all the things that they're, going to miss or that they're not going to be able to celebrate, the small things to the big things, to prom, to graduation, to all these celebrations of their accomplishments, right? So I think just helping them ground in the present and, also sort of that greater good, kind of that altruistic component helps them kind of hone in on, okay, it's not just about my loss, it's also what I'm doing for the greater good. And that kind of expands their perspective and gets them out of that sort of fierce, intense, grief sometimes.
Lisa, for some parents, this is supposed to be a gratifying time. Family time is supposed to be gratifying, but sometimes it gets to be a little bit more challenging, and then guilt creeps in. What are some ways to manage that?